Welcome to the Indigo Podcast, an exploration of human flourishing at work and beyond. I'm Ben Barron of Indigo Anchor and Cleveland State University.
And I'm Chris Everett of Indigo Anchor. For more information, please visit us at www.indigopodcast.com. So today we have a guest. Ben, why don't you tell us a bit about him?
Yeah, sure. So today in the podcast, we're delighted to have Joe Allen as our guest. Joe is a professor of industrial and organizational psychology at the University of Utah. He holds a Ph.D. in organizational science from the University of North Carolina at Charlotte, and he previously held faculty appointments at the University of Nebraska-Omaha and Creighton University. He is widely published, and his research primarily focuses on the study of workplace meetings, organizational community engagement, and occupational safety and health. He directs the Center for Meeting Effectiveness, housed in the Rocky Mountain Center for Occupational and Environmental Health, and he has provided consulting to numerous nonprofit and for-profit organizations. His research has attracted internal and external grant funding of more than $4 million since 2010. Joe, welcome to the Indigo Podcast.
Fabulous. Great to be here.
So today we're going to explore a few topics with Joe that I'm really excited about, with a focus on this cool nexus that he has of organizational psychology and the world of healthcare. Specifically, we're curious about your research on human behavior within healthcare and what we seem to know about how human behavior contributes to stuff like patient safety and other meaningful outcomes. How your research also helps us understand more about communication and its importance in creating adaptive, resilient teams and organizations. And definitely not lastly, but what we'll cover today is what implications these areas of research have for leaders and those around them.
Gosh, what a great lineup of topics. I think first, though, I'd love to hear a little bit more about Joe's background, because I think for our listeners, that's going to be interesting. He has a rather unique background, and he's an academic, but he doesn't work in a psychology or a management department where a lot of people with backgrounds like his and mine, we have similar backgrounds academically. Most of us end up in psychology or management departments, but he's not in either of those at the moment. So I think it's a very interesting story. And so I guess, specifically, Joe, how did you end up being an industrial and organizational psychologist working in the Division of Occupational and Environmental Health in the School of Medicine at the University of Utah?
Yeah, it's kind of an interesting story in the sense that when I finished my education, pretty close to the same time that you did, Ben, I was all in on being a psychologist and ended up at a wonderful university, Creighton University, working in a psychology department. And I was enjoying life there, teaching a lot of classes, making a lot of good friends and so forth. But I didn't realize that I wasn't completely happy until I changed jobs just down the street to the University of Nebraska-Omaha and started training graduate students. And the University of Nebraska-Omaha is part of the Nebraska system, which includes a medical center. So when I started working there were opportunities that started to emerge to apply industrial organizational psychology and organizational science to healthcare. And as those emerged, I started to do a little bit more of that, and then a little bit more. And over time, I was, going up for tenure to be an associate professor, then to going up for full professor. And as I started gathering my full professor materials together, I started to realize that, unbeknownst to my own, plan, I had started to build this expertise in occupational and environmental health, much more than I had ever anticipated. And so as I was working on that, I had a colleague of mine, a friend of mine, we'd written some grants together, and she's at the Drexel University, and she noticed a job posting at the University of Utah in the Department of Family and Preventive Medicine and the Occupational and Environmental Health, and said, "Hey, you ever thought about living in Utah?" And I had just submitted these materials for full professor at Nebraska.
Wow.
And so it was both weird timing and perfect timing because all my materials were ready to go. So I just literally repackaged them just a little bit, sent them off to the University of Utah, and was hired to work in their medical school. And so they saw my building crescendo, as it were, of work in healthcare, and thought this guy could really come in, bring organizational psychology and organizational science to bear on the questions that they were curious about.
Now tell me, or I'd say define for our listeners what occupational and, all those big words attached to what you do, environmental health, and I mean, we're not healing trees, right?
No, no. So this is, there's a lot of jobs that people do in this world that are not necessarily safe, and so we provide them lots of equipment and gear and other things to help them be safe. The challenge, though, is people don't often choose to don those gear, choose to engage in the behaviors that they know they're supposed to do. And so, occupational environmental health is about, okay, how do we convince people to wear the appropriate gear, and how do we change the environment or understand the environment so that way we can mitigate the risks and the dangers that are immediate, as well as the exposures that could lead to long-term health and well-being issues. So it's not, you can work in a, in a mine mining coal for 20, 30, 40 years, right? And you're not going to immediately have problems with lung cancer or black lung or any of these other things that have emerged, historically speaking, more so
Mhm.
than today. But over time these things develop, and so occupational environmental health is really about how do we keep our workers healthy, and how do we convince them to do what they need to do to stay healthy.
Yeah, I think that's super, super awesome field. Ben?
Yeah, I think it is, and what you were hinting at there, I think Joe is just the distinction between kind of an engineering approach towards occupational safety from there's all these things that we can do to kind of take the human out of the equation or make things safer, maybe from a human factor standpoint and so forth, and that's all awesome stuff, and it's really important. And then there's the behavioral types of stuff, and we'll get into that in a little bit around organizational culture and leadership and all these different things that start to play into what are the norms and the values and what we even pay attention to in the workplace, and what constitutes a hazard and all that kind of stuff. And I think it's just fascinating, and I love the fact that you as an industrial and organizational psychologist are in a medical environment for a variety of reasons, and one of them is just that I have long seen kind of a need for that. As our listeners may have, I think I've mentioned this on our podcast before, but my older brother is an anesthesiologist, and so Chris's father is also a physician, and we've done consulting work in healthcare, and I think there's a real need for a lot more of this kind of behavioral approach towards um, how people interact with each other, how they talk with each other, all that kind of stuff. So I think it's just fantastic that you're doing this type of work in the healthcare setting as an IO psychologist, because I think we have a lot to bring to that. And so thank you for that background. And I
Yeah,
think,
what about your research? You wanna talk a little bit about your research on human behavior within healthcare?
Sure. So one of the areas of research that I kind of got roped into early on, while I was at Nebraska, was there's a wicked problem in hospitals, and by wicked problem I mean a complex problem that has lots of sources of error and issue that can arise that make it very difficult to just solve easily. And that problem is patient falls.
Mm,
So a patient shows up, they've got one, they have a presenting condition, whatever it may be. They're there, they're being taken care of, and for whatever reason, they then have a fall while they're in the hospital. They fall down, whether it be in the restroom or getting out of bed or whatever it may be, and then they acquire another condition. They break a hip, they get a skin tear, they knock their head, and so then they've got a concussion. And worse, and as you can might imagine. And so uh, I was brought in to introduce something called the post fall huddle, which is similar to an after action review, which is a type of meeting where people reflect on what's happened. Right now, an after action review you can do after just normal operations. Nothing has to go wrong for you to do an after action review. But with a post fall huddle, something went wrong. Somebody
mm,
fell down and potentially got hurt. Right. And so in this particular case, there's immediate demand, immediate desire for people to start pointing fingers and blaming, right?
Mm,
It's immediate, oh, you didn't do that, and you didn't do this, and you didn't do this. What's wrong with you people? What's wrong? That sort of thing. And so my job was to come in and provide appropriate training on, okay, how can we use this to be a reflection, to learn what the root cause was. Maybe someone did make a mistake, but why did they make that mistake? What led them to that mistake? What's the root cause of the issue here? And so as we dug deeper and deeper, we found that through that reflection process, repeat falls for that same patient basically went to zero, and falls in the future, for future patients started to decline in many of these hospitals.
Yeah, that's interesting. Ben and I both come from a military background, and we have this ubiquitous AAR, or after action review process that we go through, and that's used with some mixed success. If people don't actually learn from their AARs, they just do them because they have to. That's not
mhm.
too helpful. But yeah, we do a lot of that, and then I've also had the manufacturing environment and larger enterprise organizations that whole documented process of root cause analysis. So it sounds like some of that, you kind of got the form that's set up for healthcare, but has some unique pieces to it.
Yeah, the interesting thing about after action reviews, as you already mentioned, is and debriefs and huddles and a lot of different names we call these things, is they're used in a lot of different industries already. The challenge, though, is that we know that there are better and worse ways to do it. Where there's, for example, you might have a leader who comes in and says, "Okay, this is what happened," and then you have one narrative, and anything that anyone saw or that wasn't exactly consistent with that leader's perspective is filtered out. And so there's learning that doesn't occur because the perspectives of others are not either allowed to be shared, or because the leader just basically said this is how it was. They're afraid to contradict or create conflict in that context. So there's some real interesting simple things that individuals in those contexts across these various organizations and industries can do to really make these much more effective.
Yeah, Joe, one thing that you wrote about in one of the studies that you did on after action reviews with regard to the post fall huddles was about this idea of team reflexivity. So, whether or not the team is actually reflecting appropriately on what happened and how it could be addressed and all that kind of stuff. And I think it's important for everyone, all of us, to understand just how hard that is to get a team to do that and do it well. I think it's not a natural thing. I think left to their own devices, I don't think most teams really do that well. What do you think?
Yeah, I think it's natural for humans to try to protect themselves
Mm,
if they think protection is necessary, in the sense that if something went wrong or nearly went wrong, and we can say this is with the post fall huddle, say, where a nurse maybe did something that wasn't exactly correct, or a pharmacist wasn't aware of another pharmacist prescribing a similar medication, and therefore there was an interaction. So when something did go wrong and a patient fell, right? And this is across industries as well. If something went wrong and now you're doing this reflection on it, this after action review, there's a real inherent human nature. I want to protect my ego. I want to
mhm.
protect my job. I want to protect myself from blame, from ridicule, etc.
I didn't
And
do it. Joe did it.
that's right. It was their fault, or it was this, or it was that. We're looking for reasons to not put the blame on ourselves, and I think that is probably the biggest challenge to team reflexivity, because it's all about protecting oneself. When really, if the team were to reflect and to learn from each other, whether they made a mistake or not, then the team actually does better as a
Mhm.
whole, individually and collectively. But you got to get past that immediate reaction, that immediate human desire to protect your own, position and situation and job and whatever. Get over yourself and try to get better together. And that's not consistent with human nature, particularly in the U.S. culture of high individualism and so forth. So.
Yeah. So are there aspects of I would imagine aspects of leadership or team facilitation skills, maybe just norms around risk and learning and failure, all that kind of stuff. How does that all play into it? Like, how do you actually move a team to be more reflective with regards to what went wrong or what could have been done better?
Yeah, so a lot of it comes back to a leader. In a lot of these organizations where you have after action reviews, there's this hierarchy that
Mm,
exists, and so a lot of times there's a clearly identified leader who is running these after action reviews or these debriefs, right? And so because of that, there's a real opportunity for these leaders to set the stage, right? So if the leader says, "I want to hear what everyone thinks," I want to know what everyone saw. I want to understand. And then they proceed to listen, right? And they proceed to allow everyone, and they point to the person who hasn't said anything and said, "Do you have anything you'd like to add?" And sincerely want to do that. So there's an active listening and active encouraging going on there. Then you're gonna create an environment, a team environment that is psychologically safe. It's safe
mm,
for you. It's safe for your ego, your self esteem to own the situation. If you made a mistake, you own it. If you didn't make a mistake, you own your piece of whatever happened, right? And then you
mhm,
share that. And so it's really, particularly on these strong hierarchy organizations, healthcare is one of those. Military is one of
mhm.
those. In those situations, the leader really has an opportunity to set the stage correctly for a good sharing environment. And if they do that, then learning can occur. And I think some ego can be set at the door when some team reflexivity can actually happen, and some good things can occur there.
Yeah, yeah. One thing I've noticed in the military, so I'm still active in the reserves and so forth, and so I've gotten to see over the past, 17 and a half years now, kind of what happens as you ascend in rank and so forth. And it actually can be really hard to. It takes a little bit of time to develop those norms around. I actually do want to hear, what you have to say. I actually do want you to tell me if I'm screwing things up, because as you get more senior, there's kind of this this norm that also develops where your jokes become funnier magically, and that kind of stuff where and I don't know, maybe you've seen this, Chris, too, but it's we want our leaders, especially our higher ranking leaders, to like what we say and so forth, and so there's some of this kind of self filtering, self censoring behavior that can happen. And so I think there's probably not a magical solution to that. I think that it really requires some, a track record of honestly demonstrating that humility and that candor from the leader, and maybe even sometimes, removing oneself from the situation, even physically, to say, have a conversation about this without me in the room, and then we'll talk about it later, or coming up with some other creative ways to kind of remove the barriers of that status stuff. And I don't know if you've seen any of that in healthcare, or if you have any reaction to those types of ideas.
Yeah, absolutely. I think, so if you're an established leader and you haven't necessarily been or weren't aware of good facilitation practices of encouraging participation, creating a psychologically safe environment, etc., yeah, you can turn the switch and start to do that, but it's going to take time.
Hmm.
You're gonna have to actually convince your people that you actually do wanna hear from them, and that you've turned a new leaf, as it were, if it or just, introducing new things can lead to a little trepidation on the part of others. So, yeah, it takes time for these things to take effect if you're an established leader in an established group. I think
Yeah.
also in healthcare, you're absolutely right. If the MD shows up to the post-fall huddle, it's pretty common for that MD to say, "This is what happened," and everyone say, "Yeah, yeah, yeah," and that's it.
Yeah.
Yeah, well,
Truth.
since you know it happens, why should we
Yeah,
contribute? Right.
Yeah. Yeah.
exactly. Uh,
Yeah.
it's similar, I imagine, in the military, similar to the fire service, another group that I've worked a lot with. So, yeah, if the boss or the boss's boss or whomever is perceived as being the person in charge shows up, unless they've established an environment that allows for sharing, they can end up derailing the whole process, and deliberately or inadvertently.
Yeah, absolutely. Some of the things I see that big challenges to the post huddle, after action, root cause, all that stuff is some of the stuff that I see is okay, they do a good AAR, right? And then where does that knowledge get captured to where new people onboarded don't have to suffer the same failures that their predecessors did, right? Some of that safety culture type stuff. Or in the military, wow, we're going to make a movement to this training site. We only do this once a year. Well, hey, who put where are the AARs from last year? So we know how to plan. Uh, Nobody knows. And which shows a culture. And now, not every unit's this way. There's some units that really have this locked down tight, but it definitely tells you about the quality of that organization when they don't even it it's not even worth having the sharing of learnings if you're not capturing that learnings. You also see this in enterprise project management organizations where I have mixed reviews on the PMP, but the PMP actually has a robust things about what they call organizational process assets, which this is kind of how we do things around here. And at the end of a project, as part of these project closing activities, you will capture some learnings, update the way the organization executes projects. I never see that done. They're like, "Are you kidding? You're gonna take a week and a half to document and socialize lessons learned?" No, we're kicking off another project before you even finish the one you're on, right? And so I think like with some of your research on this huddles and the stuff that we're trying to become, what they call a learning organization, you have to be able to capture this stuff and then have a platform for that to be marinated throughout the organization,
Yeah. Chris, what you're talking about is what we refer to as a multi-team system. And
right?
so what's interesting about that is I don't recall if I shared that specific research with you guys, but um, the post-fall huddle is intended to be embedded within a multi-team system where the huddle it takes place and immediately either during or as a result of the huddle a post-fall huddle form is completed where they record some of the information, the
Mm,
key information, root cause, etc., from the huddle, and then it goes to a fall coordination team within the hospital that then reviews all the post fall huddle forms to look for consistencies, right? What are the systemic issues here that if we were to introduce a change across all of our floors, we might see a change in this problem, right? And so again, that's how we implemented it because we knew that we had teams of teams. We have nurses, we have
Right.
doctors, we have pharmacists, we have nutritionists, we have PT, we have OT, like all these different doctors who may have and nurses and professionals having touch points with the patients, and
mhm.
so we needed a way to gather the information, create a separate team to then evaluate that information, and then disseminate that out with the blessing of administration and leadership to make those changes, to make wholesale changes if necessary in how things work. But I think you're absolutely right. A lot of organizations, military included, they have a lessons learned department who mines the data occasionally, but that doesn't necessarily get back to the rank and file, to the people that are actually boots on the ground, literally doing the work. So I think there's opportunities that are missed in a lot of organizations because they don't recognize the possibilities of their already existing multi-team system.
Right. I think the thing, and to Ben's point a little bit earlier, is if at a minimum, this doesn't come for free. This is going to cost some organizational time, So if you're running your organization super lean and everybody just barely gets stuff out the door, whatever the shipping product is for you, seeing a patient, answering call center calls or whatever, you don't accidentally get better. Like maybe people self-organize a little bit, but you actually have to devote some time, and that time needs to be structurally supported by however you're organized. As a scrum team, a little bit of self-organization. That means as a collective cohort, you're going to say, guys, we need to do a sprint review and a sprint retrospective, that kind of thing. If you're in a hierarchy and it's not getting done in a self-organized way, you got to programmatically build it into how your organization operates if you want to get better.
Yeah, yeah, that's really important. One thing I was just wondering too when you're describing all this work, Joe, is it seems like the post fall huddle was a really good kind of um, I guess isolated or compact type of event that you were able to study well. And I'm just wondering, are there any? I don't know the answer to this. I was just wondering if you do. Are there any other types of things within the healthcare environment where those similar types of approaches might be helpful, or things that you're aware of that where it's been being introduced aside from the post fall
So,
huddle?
referring to debriefs or
Right.
after action review type things?
Yeah.
Yeah, absolutely. So there's a pre-brief and post-brief whenever a surgery team does a surgery.
Mm-hmm.
And there's also simulations that are done with medical students. They do lots of different simulations on cadavers and other procedures. And when they do that, they often have a pre-brief, but not always. But they always have a post-brief, a debrief, right, of how things went in their processes. So it's used quite often in a lot of different settings. The interesting thing about that is there's been limited access to those settings. I know of a couple people out of Clemson that been able to get access to those particular interactions
Mm-hmm.
that are very similar to a post fall huddle. And have been able to start introducing good facilitation practices and so forth in those settings, and have been seeing some interesting changes there. So there are other places within healthcare where this is already, or at least the huddle or debrief idea is already being used, but I don't believe in many cases that they know the best practices. I don't know to what extent, and this is just the honest truth. I don't know to what extent they capture those learnings either.
Right.
So
Yeah. Another thing I'm wondering too is, so as of this recording, you're relatively new in your current position at in the medical school there at the University of Utah. I'm wondering, what opportunities there are for integrating some of the findings from your research around how to make a team more reflective, and how to do these in a way that actually produces some results and can be good for patient safety, et cetera, at the medical school level, so that when as people are going through their initial training and then getting out there, they already have a good baseline for what this should look like and how to get the most out of it.
yeah, there's some interesting and neat opportunities. I haven't yet, I'm very early in my time here, and I'm just meeting a lot
Sure.
of people and so forth. 4 months in, kind of thing. But there are some really neat opportunities in that regard because, as I mentioned, there a lot of the medical doctors in training, um, they are doing a lot of hands-on activities, right?
Hmm.
Whether it be surgeries or any number of other type of thing, right? And because they're doing that, there's ample opportunity for them to engage in a debrief or meetings in general, right? And so there's lots of knowledge that could be trained and shared there to develop them, so that way when they get to their residency and then to their actual final resting spot, as it were, in terms of a job, they'll be able to do those things, know those things, and do them when interacting with others, and maybe minimize the effects of hierarchy on the way people interact and the way people act in these, whether it be post fall huddles or debriefs or whatever. So yeah, there's a real opportunity there, one that was just barely beginning to be explored at Nebraska, and then I decided to leave. So I don't know to what extent that's carrying on. My initial conversation with them kind of fizzled as I left, and so I'm hoping that I can step that up and do that here, and then go more broadly as those things start to emerge.
Yeah, I think that's really awesome. So another thing that you've dealt a lot with is high reliability organizations. And, when you deal with the falls and the AAR process, that helps organization improve. Let's talk about first, what is a high reliability organization, and how does somebody move along that kind of maturity scale to become even more reliable?
Yeah, so a high reliability organization, essentially what that is, it's an organization that works in a dangerous environment or does work that is considered dangerous or risky, but for whatever reason, they don't have the kind of accidents or injuries or deaths or property damage or whatever that you would kind of expect to happen a little more regularly than they do,
Hmm.
right? So some good examples of that, we've already been talking about healthcare. Opening up a human and digging around in there is not a safe thing to do. It's just not, right?
Hmm.
And yet we don't kill people as often as we probably would if we just open them up anywhere. So that's a highly reliable organization where that we're doing all sorts of things to mitigate that danger. Others would, like nuclear power plants. You're playing with nuclear stuff. That's not inherently safe, and yet we can
Right.
count the number of times a nuclear power plant is melted down on one hand, right? Uh, you got military. You're carrying around weapons. You're being shot at. The people you're shooting at people. That's part of the engagement. That's going on there, and yet thankfully, fewer than more people die than we would like, but fewer than you would expect, given that we're throwing pieces of metal all over the place at people, right?
Hmm.
And so these are organizations that are high reliable organizations, highly reliable, working in a dangerous context where more than the damage and danger and outcomes that we see would likely happen if you put people that are not as highly trained as those folks into those settings. And so I think that's the key here is that these organizations are doing things to mitigate the danger and the risk that they're experiencing on the job, whether that be through equipment or gear, or through processes and procedures, through checklists, which are wonderful tools. And so they do all these things, and there's some various hallmarks of high reliability, but they do these things and they reduce that error to levels that are slightly more acceptable, even though we're always trying to, and this is a hallmark of a high reliability organization, always trying to get better, always
Hmm.
trying to reduce those errors and reduce those injuries, deaths, and damage and so forth to zero.
Yeah, yeah. This is a common research interest that you and I have, and
Yeah.
the hallmarks of high reliability, comes back from Carl Weick's work way back when, and we'll put some stuff up in the show notes about that. And I recommend to anybody out there, regardless of what you do in terms of your career, reading his book that he wrote with Kathleen Sutcliffe. Managing the Unexpected. It's just a very good book, and you mentioned these hallmarks of high reliability, and one of them is having a preoccupation with failure, and actually talking about knowing explicitly what it is that we as an organization or as a team are trying to avoid, and then talking about that, taking proactive steps to make sure that it doesn't happen. And I just think sometimes that that approach is super helpful, and it flies in the face a little bit of some of the, I don't know, kind of more romantic visions of leadership always being about rah rah, keep it up, you're being inspirational all the time. And maybe sometimes that happens, I think, to the detriment of really exploring what might happen, what could happen, and some of this preoccupation with failure that can be really important to talk about.
Yeah. I think you have to know when to be rah rah and when to delve a little deeper and say,
Yeah.
okay, something wasn't quite right here. Let's talk more about this. Let's figure this out. Which item of the checklist was skipped? What's going on? That sort of thing. And I think a good leader will hopefully learn to recognize when to be rah rah and when to maybe not be quite so
Hmm.
enthusiastic, and really dig deeply with their people to understand, to engage in that preoccupation with failure, because failure is a bad thing.
Yeah,
Well,
yeah,
well, one of
totally.
the one of the differences that I see is like out in the corporate world is everybody's like, awesome, here's our business plan, or hey, we just sat down with Deloitte and we've got the super strategy map or blah, and here's how we're gonna be successful. But when we look at, like we both live in Utah, here, Joe, and the Avalanche Center. That it's not a if they're gonna have to do a rescue and navigate really dangerous terrain and probably get hurt. It's a win, right? If you're on a ship, there are gonna be injuries of people while you're out at sea. I know if I have to walk 800 guys with, you know, massive military equipment on their backs just 1 mile through the woods with nobody shooting at them, we've got at least 6 sprained ankles or whatever that number is. And and it's the acceptance of failure as part of your daily life, and that's going to happen, and that you need to plan for it so you can mitigate it as much as possible and always be learning,
Hmm.
especially if there's a life and death situation. You're going to be more inclined to take a learning from how that person passed away because you're working in that same environment, right? And so I kind of like that difference in perspective where, certain businesses now they'll generally have, like most mature companies and organizations, have a baseline of this. But I think if they really dig into the data and research around high reliability organizations, that they can gain a lot. So, okay, so it's the focus on mitigating the failure. What are some communication trends that you see within a high reliability organization? What's communication look like within those?
Well, that's a good question. It's communication. It depends on the organization in a lot of extent, but in a high reliability organization, uh, everything we talked about earlier about creating a safe sharing environment where people can bring up things when they happen is a key attribute of a high reliability organization. It means that the lowest person on the hierarchy should be able to speak up and say, "Wait a minute, look at that over there," or "Wait a minute, what about this?" That sort of thing, and not feel like they're going to be ridiculed, persecuted, get in trouble, that sort of thing. And I think whether you military or fire service or healthcare, whatever, I don't know if that's really truly felt by the lowest people on the totem pole, as it were.
Right.
The new hires, the new MDs, the new nurses, that sort of thing. I don't know, even though we preach this a lot, I don't know if we've really communicated effectively that, yeah, you really can speak up and you should speak up and you need to speak up. But I think that's a really important thing. That flow of information, top to bottom, needs to be and it should be, normalized within a higher reliability organization. And I think some of them do it.
Yeah, yeah, and so you kind of alluded to it here, and you explicitly mentioned it earlier. This idea of psychological safety.
Yeah,
What's that
yeah.
about?
So psychological safety, that's essentially the feeling that um, you as a person, as an individual, are safe to share who you are, as it were, and the things you see and the things you hear and the things that you're doing with those in your organization as you work, and ideally inside and outside of work, right?
Hmm.
I think too often we segment, and this has been kind of tradition in a lot of organizations, that we segment ourselves to exclude the things outside of work from work, and thereby excluding really possibly some good ideas from being brought forward, some creative, innovative ideas and so forth. So I think in corporate world and so forth, I think we really need to encourage this idea of psychological safety, both in terms of what we said earlier, this whole blaming thing. We gotta stop that so we can learn from each other, but also just being individually feeling you're safe psychologically, self-esteem, ego, etc., to be who you are, express that, know that it's valued. That's why you were hired in the first place, kind of thing,
Right.
and then bring that forward in a meaningful way to allow for innovation, creativity, and the kinds of adaptation
Hmm.
rather, that is necessary to succeed in our very complex, globalized economy and corporations and society that we have.
Yeah, yeah. And I think a big part of that is, the willingness in a group, in a team, to take those interpersonal risks. Right. So, I think this ties in well, Chris, with, some of the stuff we've seen and done with teams and with groups about, differentiation and not being kind of emotionally fused with other people, so that you can feel like you have that ability to dissent within the team, that you can say, it seems like everyone thinks this one way, but I'm going to be the one who says, I don't think that's right, or I think we should do something else.
Yeah, it's so interesting. So, everybody, I don't know, fantasizes or has this fantasy ideal of the .com startup, which was really just maybe too skeezy software developers sitting in a ratty garage while their mom paid rent, right? But bear with me here. So, like, the culture in that environment is if you want to leave 12 empty Mountain Dew cans on your work desk console, you flipping could, right? Contrast that on the other end of the spectrum where everything is sterilized. You can't bring yourself. Somebody that onboards in that kind of organization is going to feel very rigid and tight because they don't know what the norms are. But guess what? They're going to be easy. The norms are be like a Best Buy Old Navy. You know, you're a cookie cutter seen in every town in America, right? You've completely neutered and sterilized. Or you see this other organization that's kind of this like hybrid. We're completely sterilized and have completely neutered our employees so they can't bring their whole person to work, but we've got a beer keg, right? You know? And so, like, I really liked when you're talking about that, Joe, is like, we've got to provide an environment for humans to exist. It's going to make work way more fun to be around. It's going to also help your employees develop more emotional and personal resilience as they learn to interact in respectful ways with people that are different than them, that have different ideas. But out of that environment, you're going to have, at least in software, you're going to have better products. And in a realm of safety and high reliability organizations, you're going to have people thriving and socially sharing these things amongst themselves that, you know, in times and ways that a norm formalized and command and control type system might not capture.
Mm-hmm. Mm-hmm. And I think it's important to note that these high reliability organizations, they're not error-free organizations. These are organizations that, due to their the way that they interact socially and they communicate and they are noticing and watching for certain hazards and so forth, they catch those small things before they become big ones. And the idea is that this type of mentality, these types of interaction patterns, don't just need to exist in those high risk types of environments, and in fact, has a lot of applicability kind of across the board, as we've already mentioned, to other types of industries where you have teams that where there's a high level of psychological safety, where they can catch small things before they become big problems. They are very well attuned to those weak signals of either opportunity or danger, and can really adapt quickly. So I think there's a lot that we can learn from those types of organizations.
Yep. And Chris, what you mentioned there in terms of organizations that make it difficult for you to be who you are, what you're kind of describing is this idea that organizations have culture, and because of the culture they have, whether it be tied to their high reliability, situation like Ben was just describing, or whether it be other things, that can inadvertently create an impossibility around someone's, who they are, bringing that to work, right?
Right.
And so we have to think about and be more deliberate in understanding what our culture communicates. We
Hmm.
here at Pepsi, or we here at Coca-Cola, or we here at, what name, Old Navy, name the company, right? We want to have a mission statement. We want to have a vision statement. We want to have these policies and procedures. We create these rigid structural attributes of the organization that then constrain the behavior to the point where culture becomes and socialization in those organizations becomes so constrained that you get this cookie cutter corporate worker
Hmm.
who is afraid to bring this new idea they thought of while they were vegging out to the latest Netflix, show or whatever, right? They have this epiphany on the weekend. How dare they think about work on the weekend, But they did. And now they
Because
can't
the
they,
work was awesome and it
yeah,
wasn't neutered, you
that's
know?
right. They were allowed to think about it in a way that they hadn't thought about it before because they weren't sitting in their cubicle and walking back and forth to the coffee machine and not feeling like they could say anything to their boss because their boss didn't want them to speak up in the last meeting. And so I think we've created a cultural environment in a lot of organizations that constrains innovation and creativity. It
Hmm.
constrains people's psychological safety. It makes it impossible or difficult, at least, to speak up and stand out. And then we find out, well, Bob over there spoke up, and now Bob's a partner in the organization, right?
Right.
And so we see these examples of speaking up, but we also see the other people who disappear.
Well, and it can be
So
crushed. A lot of that stuff can be crushed. So if
yeah,
you're in a place where there is high legal liability for failure, and you're in an organization or environment, industry where failure is going to happen regardless, right? Um, well, lots of times it's like, okay, we're going to have everything dialed down so that when the lawyers come around, we can say we followed these legally defensible procedures, right? And it becomes sterilized. And you basically, I see it all the time where the leader will chill out or cool out anybody below them from saying anything. Everybody has their, oh, well, Billy lost a finger. This is what happens. And it's just cut and dry so they can get back on to work. Okay. I understand why that would develop, right? Everybody's scared of that risk, but you can still, from that platform, grow. You don't have to stop at that legally defensible place. And I think it's even better if you can say, not only are we here, here's our learnings from the last year and how we've improved. And anybody can speak out on these things, and you can meet both of those criteria.
Yeah, I think that's actually true. I think there's a lot of flexibility once you meet that minimal legal criteria in what your organization can do, right? In
Hmm.
terms of culture, in terms of ways people interact, that sort of thing. So we understand there's a minimum standard, um, and 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 we need to abide by those minimum standards, as it were. But once we get past that, what are the other things that we're in it, we're creating, and what culture that we're creating through our policies, procedures, practices, vision, mission, etc., that are, constraining our people in ways that we don't really mean to.
Hmm. Yeah, yeah. So we've talked now about your work and how it relates to some really important outcomes like patient safety in the healthcare context. We've talked a little bit about some of this additional research on communication and social interaction, how it's important for adaptability and resilience in teams. I think we could maybe turn our attention now to some of the implications for this research, and maybe try to we can work together here and try to distill out some of those things that leaders and others in healthcare or other types of contexts, what they should do based upon what we've talked about here today.
Yeah, so kind of the thing that comes to mind to me is that we often think of these debriefs or post fall huddles or after action reviews as being something that they do over there in the fire service or in the police service or in healthcare or whatever. And we think oftentimes in our corporate environments that those don't really apply to us. We're not doing anything dangerous or
Mm,
whatever. And I think one of the things I want to make sure as an implication for leaders here is that even though we've been talking about healthcare and we've been talking about, military, we've been talking about high reliability organizations, there's no reason most of these things can't immediately be translated into the corporate environment, right?
mhm,
Didn't we just complete a report on a project? Didn't we recently complete the development of a new, widget over here? Whatever it may be, whatever the latest thing was, we can get our team together. We can have a reflection and do so in a way that encourages participation and increases psychological safety, that doesn't constrain them from a cultural perspective, from an organizational cultural perspective, that sort of thing. We can do those things right within the corporation for these regular operations that we do. And I think that's a key implication for me, is that this is not just about what these organizations in dangerous environments can do.
yeah, yeah, absolutely. I think it can definitely apply to other types of contexts. And a lot of it comes back, and maybe this is just my bias, being just for my own personal interest and so forth. But I think a lot of it does come back to how you position things as a leader, how you facilitate team interaction or don't as a leader. And I think what I've noticed, at least in my own practical experience, is that if you leave these things to their own devices, then usually you're not going to get the outcome you want. And sometimes you can unintentionally create an environment in which people feel like they can't speak up, or they can't be different, or they can't have some sort of innovative idea just because they value kind of agreement with the group over being candid and being dissenting in that context.
Right. One of the meeting styles that I see, especially in command and control environment, is the brief the leader or round robin. So there's some agenda maybe, and the person that's in charge is sitting at the end of the desk and it's like, all right, person to the left. Okay, next person to the left, right? And everybody goes around, and that is not a format for engaging this kind of creativity and growth and reflection organizations. Or I've seen AARs conducted, and I need 3 things we should keep doing. Oh, you had a fourth? No, it's okay. We only accept 3. All right, now we need 3 because the form has 3 on it, right? Or
Right.
something like that, and it's super, super rigid, and, like, so much of our episode here has been about talking about how the leader facilitates this. If you're in HR or if you're a senior leader, these behaviors aren't generally modeled around. You need some kind of training and development process to teach people, 1, how to conduct a daggone meeting that doesn't squelch creativity, right?
Mhm.
2, how to facilitate because, Ben, you and I talk about the Shawshank Redemption effect. They've been institutionalized. All your workers that have grown up in these other environments have learned that, oh, I'm at another round robin meeting. Okay, they don't know how to bring their whole self to work unless it's on the odd chance they're at one of those better organization that does. So you kind of got to attack it from a couple fronts, provide that leader training and not just a book on boxing and send them into the ring. Check in to see how those leaders are facilitating those meetings, right? 2, you gotta like check in with your people, right? Do they feel, there's different ways of surveys and different ways you can measure with this organization. Do people feel that they can bring their whole self to work? And um, do they feel that their managers are facilitating a high reliability organization, safety based culture, all of those kinds of things? And it's not in a way that you can place blame and give somebody the boot, but for, you know, training from the top, facilitating and training from the bottom to create that stuff.
Yeah, I mean, what you're describing there is kind of the best practice, as it were, in terms of training and development of people, right? Train them on what to do, and then hold them accountable to what you've trained them on what to do, and ask people who are who didn't get trained, how are these people doing on what you trained them to do, right? So you're describing exactly what organizations should do, whether it be for this specific thing on facilitation for creativity and innovation within their meetings, and creating that psychologically safe environment when doing reflection meetings on what recently happened. You're talking about the best practices here, but I think the biggest thing that I have found with organizations, whether it become related to meetings or just about any other training, is we often don't hold people accountable to do what we've trained them to do. Unless it's
Right.
something that's required in order for the widget to go out the door, it's not we don't then go back and say, "So, how you doing on that?" Or,
Mhm.
"So, how is your manager doing with, changing from the round robin to a more collaborative discussion, type of meeting?" Right? So, and unless we hold people accountable, or at least ask them, and that's the accountability doesn't have to be, "Oh, we're gonna dock your pay," kind of thing. It could just be, "Hey, how's it going? Do you remember that training we had? What have you been able to implement it? How, is it working for you? What's not working for you?" Basically do the reflection on the training that's going to
Mhm.
encourage them to do reflection. So,
Yeah. So Joe, I think I want to like dig into that point a little bit because I think it's a really good one. And I want our listeners to think about this because you know I think this is particularly applicable to some of let's say you go through a leadership training or some sort of managerial skills training or something like that. I agree that oftentimes then people go back to their jobs and supposedly there's what we would hope for and what we would call a transfer of training back to the workplace. We're actually doing something, but oftentimes it's not reinforced well, and there's no real accountability for, hey, like, we just had this great session on how to run meetings that don't stink, and you just ran a meeting that stunk. Let's oftentimes that doesn't happen in
What
terms of,
happened here?
yeah,
Let,
what
let's let's
happened.
have a huddle on this meeting.
Yeah, I mean, I don't know, like, why don't organizations do that?
Well, it's because they're populated by humans.
Darn it.
Ben, you just came at it. So we're always talking about managers and like these guys are not cogs, they're real people.
Yeah,
Yeah.
And then Ben,
right.
you're like from the happy side. It's like, well, why can't these managers not be real people?
And so really it goes back to habituation and context cues, and these are, basic social psychological principles, but things that many of us have heard in our liberal arts education and so forth, but have not translated that into the workplace.
Mhm.
So we're used to certain things happening a certain way. And so when we go from the training where we learned about a new way to do things to a situation where we've always done it a certain way, every cue in the environment says it's going to go the same way it's always gone. It's really, really hard to get over that inertia. It's really,
Mhm.
really hard for a person to say, no, 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 we're not going to do it the same way we've always done it. We're going to do it this other way. Right. Particularly if they're the only person who was in the training, too. So we train our managers, we go to the meeting, and everybody in the room expects a certain script to be followed.
Right.
Bob, then Susan, then Jason, then Samantha, on down we'll go around the room, we do the round robin. And if they don't see that, they're suddenly, oh, what's going on? So and so this it creates comfortableness among the people, right? And so
Yeah.
I think there's a challenge there to habituation and just context cues and what we're used to doing. And so we have
Yeah.
to fight that constantly, particularly after we get a training where we get really excited about it and then go to an environment where, man, this is the way we've always done it.
Right, right. And as humans, we do crave routine. We crave predictability. At least most of us do to some degree. We want to know, what to expect in certain situations. And this is where, social norms and expectations can be very helpful. And yet they also can come at the detriment of doing something differently. Or if our routines and our habits are wrong and they aren't being helpful in whatever context we're in, then changing those, it presents an additional barrier to change.
Agreed.
So, Chris, you want to give us a little wrap up of some of the things we've talked about today?
Yeah. So today we've talked about the contribution of some great social science research on human behavior to the context of healthcare, how learning about how these high reliability organizations can also help us understand more about communication and its importance in creating adaptive, resilient teams and organizations, and some of the implications that these areas of research have for leaders and those around them.
So, with all that being said, Joe, I guess one last question for you. In general, what do you think about the potential influence that social science research, like the work being done by you and others in fields like industrial and organizational psychology, can really have in the world of healthcare? And we'll let you have the last word.
Great. So I think there's an immense opportunity here. There's a lot of things that are both intuitive and not so intuitive that social science has discovered and learned about the way that humans operate, the way that we function as people, the way we interact with each other, and how we can care for and be good stewards of each other when we have those opportunities. I think the challenge, though, is we know these things, and then there's this wonderful thing called the science practice gap. And so it's we learn all these things, we publish them in these wonderful journals that we share with each other in our academic silos in our ivory tower, as it were, and then we don't translate that well to others who are actually doing the work that we're describing in these journals. And so I think the biggest challenge, and one that I think you guys are doing a great work here with Indigo Anchor and so forth, is bridging that gap. It's taking that science, that knowledge that social science has, that wonderful information that we've developed over years, and saying, let's take the most meaningful and best practices that we know here, and let's make sure everybody knows about them. Let's get it out there. And so for healthcare, one of the neat things when I got hired here at the University of Utah was they started to have challenges with getting grants funded, and one of the things the funders were saying to them was, "This is really insightful, neat research. How are you going to convince people to do it? Do the
Yeah.
training, wear the new apparatus,
Uh-huh.
do the new process, whatever it is. How are you going to convince people to do it? You need a psychologist on here to convince people to do that. Well, that's what social science is all about.
Right. And
It's
now for
helping
the
people
rest of the
know."
story.
Yeah.
That's right. So there you go.
Awesome. Joe, thank you so much for your time today. This was just tremendous. Definitely the research you're doing, which is a lot. If you guys go Google Scholar, which we'll have a link to his stuff and the show notes, you're doing such good work out there, and then such a unique niche that you're sitting in. And thank you so much for your time today and for being on our podcast.
Yeah, thanks so much, Joe. It's great. Thanks for listening to the Indigo Podcast. If you like this podcast, please consider helping us by rating us on Apple Podcasts or wherever you listen, telling your friends about us, having us on your podcast, or mentioning us on social media. Our website is www.indigopodcast.com, where you can access more information about us and this episode. Thanks again, and we look forward to talking with you again soon.